Hi, I'm Dr. Robert Silverman, and I'd like to invite you to my Sports Nutrition and Performance Certification Part 2 on January 19th and 20th. On Saturday the 19th, the hours are 9 to 6, and Sunday, January 20th, the hours are from 8 to 12 at Northwestern Health Sciences University. All of you who have seen Part 1 know the exciting information that you'll learn over that weekend, and that exciting information which you'll be able to turn into a Monday morning implementation with your patients. Part 2 is going to consist of, in addition, an expansion of movement and movement and pain in the athlete. The modern athlete now is moving so fast, so powerful, but the problem is, are they really moving appropriately? Are they moving efficiently? Do they have proper form to function to performance? We're going to talk about fascia, fascia's place in the athletic world, and how we as practitioners can examine fascia, treat it, and give nutritional protocols to help heal it. I'm going to talk about the differences between the endurance and the strength athletes, the foods, the fluids, the training methodologies. I'll be covering pH and the detoxification of an athlete. It's a huge area. We always assume our athletes are perfectly healthy as far as their immune system. And the interesting thing about the world right now is, and the question is, it's not are you toxic, it's how toxic are you? And our athletes are exposed to toxins. So how are we going to detoxify our athletes that will enable them to get to athletic performance? And pH, which we want to keep at 7, is a critical component. Also an addendum to that type of detox, I'll be unfolding the first time an estrogen detox for all female athletes. 50% of the athletes that you'll see coming in your office are female. We really have to deal with the estrogenic issues and inability to detoxify estrogen. In addition to that, we'll be talking again about some ACL protocols and bone health within women. We'll be ending with a lot of discussion on sports supplements, the hot ones, beta-alanine, creatine, omega-3s, amino acids, and the like. Get a litany list of questions patients always ask me about whey protein and all these supplements. Should they? Shouldn't they? How old should the athlete be before they take creatine? As we go towards the second day, we're going to cover kettlebells. Kettlebells for rehab. Most precisely, the 7-step Turkish get-up. What a screen for an athlete. We'll be breaking down the movement in its 7 parts, as I said earlier, but in each part, we'll talk about the muscle imbalances and the things that you could see. We're also going to have a corrective exercise program for every weakness or muscle imbalance that we find in that Turkish get-up. And finally, I'm going to expand my discussion on core, or should I talk about core, any anti-portions of the core, why we don't want anti-rotation, anti-lateral flexion, and anti-extension. Please come join me once again, January 19th and 20th, in a week and a half, 9 to 6 on Saturday, 8 to 12 on Sunday, for Monday morning ready sports nutrition performance.